Good morning and welcome to Business Today. I am Umar Kaltungo. Now we will be discussing the coronavirus pandemic now that has become unending. It has continued to worry. It has become so worrisome and it has impacted in several sectors of the economy. But today we'll be looking at its impact on the pharmaceutical industry itself. Now the coronavirus, the virus itself is responsible for the COVID-19 pandemic, which is new to humans. And doctors had no specific medicines to treat it at the start of the crisis. But a scramble to fill that void has been on in the last few months, with the first medication backed by early clinical data authorized to fight the virus. Now, efforts are still on to find better treatments and develop a vaccine that will prevent coronavirus infection to start with. Now, in normal times, the process of approving new drugs and vaccines is slow and painstaking, but it can be accelerated in times of crisis such as this, but at the risk of doing more harm than good. Well, let's ask this question. What's the proven treatment? Now, in late April, researchers announced that remdesivir, an experimental antiviral drug that Gilead Sciences Incorporated originally made as a treatment for Ebola, helped patients recover from COVID-19 more quickly than the standard care. Now, days later, it was cleared by the United States Food and Drug Administration, the FDA, for emergency use in COVID-19 patients. The authorization was limited to hospitalized COVID-19 patients with low blood oxygen levels or those who need breathing support. Japanese and UK regulations have also given special authorization for use of the drug. But is there anything else? The FDA in March, for example, controversially issued an emergency use authorization providing for two malaria drugs, that is chloroquine and hydroxychloroquine, to be distributed and prescribed by doctors to COVID-19 patients. The move came after President Donald Trump repeatedly touted the drugs. He later said he had taken a course of hydroxychloroquine, although he is not infected with coronavirus. But the FDA cautions against the use of this drug or the chloroquine for COVID-19 outside of a hospital setting or a clinical trial due to the risk of heart problems. But emergency authorizations are permitted during a crisis when a product that is known and the product has known and potential benefits, they kind of outweigh its the risk. The Russian government in mid-April ordered the free distribution of this same chloroquine, which hadn't been registered for use in the country previously for treatment of coronavirus. But there's been some kind of controversy. The FDA's decision and Trump's championing of the drugs have been characterized by scientists or criticized by scientists as premature. Now, studies suggesting both harms and benefits to hydroxychloroquine used in COVID-19 patients have been withdrawn or retracted from publication. A large study in the UK, for instance, published in June, found no benefit whatsoever. But panic buying of this hydroxychloroquine has created shortages of the drug for patients with malaria and of course autoimmune disease lupus. That is another disease that is being treated by the same drug, for whom it is proven it has a proven therapy. But are there other treatments that are being tested against the COVID-19? More than 100 different programs have been launched to develop and test these treatments. These include everything from antiviral drugs to antibody containing plasma from recovered patients to traditional Chinese herbal medicine to even the Madagascar experiment. A number of studies are looking at whether drugs for rheumatoid arthritis, cancer, autoimmune disorders. These are all drugs that are being tried, whether they can halt dangerous inflammations. Sometimes they can be lethal. But what about vaccines? About 100 experimental vaccines against the coronavirus are in some stage of development. This is according to the WHO, that's World Health Organization. Moving at record speed, researchers begin preliminary human testing of the first one in mid-March in Seattle area. It was developed in the United States National Institute for Allergy and Infectious Diseases in collaboration with a biotechnology company that is Moderna Incorporated. Since then, a handful of additional human trials have begun for this vaccine, including those from other companies, other biological companies, and then of course the collaboration with the Beijing Institute of Biotechnology, and then quite a number of other companies across the globe, and they are all working on a vaccine project, including the other big companies that are very popular here in Nigeria are GlaxoSmithKline. They have also teamed up with the Chinese-based Clover Biopharmaceuticals project. They are all trying to get this. But let's come back home now. In Nigeria, according to the Minister of Health, Dr. Osagi Ehanire, he said Nigeria will not rule out homegrown vaccine towards the prevention and cure of coronavirus. He said this at not too long ago while fielding questions from journalists at the Presidential Task Force on COVID-19 daily press briefing against the backdrop of some countries coming up with locally manufactured vaccines for COVID-19. Countries like Madagascar and of course quite a number of other African countries have also made attempts at trials, including Ghana. And then of course here in Nigeria we have had some Nigerians making efforts to ensure that they come up with some kind of drugs. We have seen one doctor from Yobe, and like that. They have been all around. But now the question is, how many of such trials are actually ongoing in Nigeria? Another question is, how has this coronavirus pandemic impacted on the pharmaceutical industry in Nigeria? Well, I visited a European-trained pharmaceutical researcher and manufacturer, Umar Ndagi, to discuss this. Don't go away. After this break, we'll give you the interview we had with him, and maybe it will shed some more light.
Every day, you wake up to a fresh, hot breakfast.
That's when we bring you the stories.
Tighter financial conditions, reduced trade and investment, as well as substantial decline in commodity prices.
We give you the numbers. Factual and analytical.
Demand will exceed supply and inflation will go up and so on.
Whether it's downgrading of Nigeria's rating by Moody's and Fitch rating agencies,
sizzling hot and fresh. Join us.
I am Umar Kaltungu.
I am Aisha Muhammad Ahmed. It's Business Today, weekdays at 7 a.m.
Only on Liberty TV, Voice for All.
Alright viewers, you're welcome to the interview segment of the program Business Today. And today we took a trip to visit a pharmaceutical researcher, the person of Umar Ndagi. He has been into research of herbs and all other, I don't know the composition of some of the things they do to produce some caplets, but I do know that they are herbal in nature. And since the advent of COVID, people have been trying to find vaccines, medicine, and all that. And he is also doing that as well. And then, because of his research, he has come across all types of curative stuff for some other illnesses. But let me introduce you to Umar Ndagi, a pharmaceutical researcher. You're welcome to the program, sir.
Hello, good morning.
First of all, this is the COVID period, and it has impacted differently to the different sectors of our economy. And today we are looking at the pharmaceutical sector. You are a pharmaceutical researcher. How has this advent of COVID-19 pandemic impacted on the pharmaceutical industry?
Basically, it's impacted this industry in several ways, actually, because now there is, should I say, a scramble to find something for, maybe not cure, but better management, even if it's symptomatic cure of COVID-19. Yeah. The unfortunate thing with this industry, especially in Nigeria, is that there's a dearth of research interests or research ability. In that a lot of people are actually interested in doing drug research, but they don't know what drug research actually entails. The fact of the matter is that before you can declare any cures or even anything to manage any ailment, not only COVID-19, you need a clinical trial that should be unbiased and unaffected in any way by any external factors, and it should also be reproducible. So unfortunately, this is a very expensive process. It can be time consuming. So in a way, the bigger companies or the bigger, should I say, government organizations in certain countries like NIH in the US have more or less of a monopoly on what they do research on. You could have smaller companies claiming to have something that could be effective on it. And it might be effective, but those smaller entities might not have the ability to prove their claim through a clinical trial. So they're more or less shouted down as making bogus claims, which really what the government or the people in control should do is really look at what that person is claiming, look at the merit of those claims, and then decide if they will invest in a clinical trial or not.
So you are saying the clinical trial is expensive?
Yes, it's very expensive and it's very time consuming. Okay. Normally it takes about, I think, 10 years to 20 years to get a drug on the markets from research. You have the situation of COVID-19. We can't wait that long. So so there should be an expedited process to do this. But right now there might be some guidelines on that, but it's still not something that smaller, non-financially robust entities could actually carry out. It's something that larger government bodies, I think in Nigeria recently there's some sort of grants or some sort of soft loan being given for pharmaceutical companies by the CBN. Well, I'm still not sure how accessible this sort of grant is, because it still needs a certain acumen, a certain intellectual capacity for research, which fortunately we in this company, we have that. We'll be able to do it. We have executed clinical trial before in conjunction with Kaduna State University Teaching Hospital. Thus for immunozine, for sickle cell management.
Okay, this one.
Yes, but
is this also plant-based?
This is purely plant-based. It's an immune booster and vitality promoter, which seem to work very well in sickle cell management, in crisis prevention. So we subjected it to a clinical trial. That clinical trial cost us about 15 million naira to execute. Yes. Yes.
But let me ask you something.
Yes.
How did you get here anyway?
Well, I grew up in Europe, in Berlin, Germany.
I see.
And from the age of 14, the first taste of herbal medicine I ever had in my life, although being a Nigerian, was in Germany. So I thought, wait a second. I hear a lot about herbal medicine back in Nigeria, because at that time I'd only spent about 2 years in Berlin. And I mean, being in Africa all the time before then, I thought, okay, we have these, but I've never ever used it till when I came to Europe. So that's what spurred my interest. So, you know, finishing secondary school there, going to university, I thought, well, I've always been interested in, you know, studying drug production. I'm not so interested in drug sales, but I'm interested in drug research and development and manufacture.
Yeah.
So I studied within the pharmaceutical industry.
Any support from government since you came in to start this?
So far, no. So far, no. But actually, a few years ago, we got into an incubation scheme, National Board for Technology Incubation, where they give us production units. So that production unit actually helped us to secure, you know, NAFDAC approvals for our products. So I would say yes, some level of government support.
Okay. But the big question now is, there have been several attempts for herbal cure to this COVID-19.
Yes.
We have seen the very famous case of the Madagascar drug that was even imported for trials and all that.
Yes.
And apparently they haven't been able to get it right. Is it that we don't have the right composition, we don't have the right materials, or is it that government is not encouraging researchers like you to go into proper research on this COVID-19 cure or management?
Yes.
What is really the problem?
Yes, I think this a multifaceted problem actually, because yes, NAFDAC has categorically said if you think you have what it takes to cure COVID-19, you come forward and subject your drugs to clinical trials. So clinical trials is the issue, because obviously if you go to NAFDAC to subject your drugs to clinical trials, you have to fund it. Clinical trial is a very expensive enterprise. But
I thought since government is interested in finding cure,
yes,
they should be able to fund those who are willing to go for clinical trials.
Yes, exactly. I don't know of any such funding available right now. Maybe at a stage from a grant that's being provided by the CBN. I heard there's a grant. I heard there are certain levels of funding available to tertiary institutions. So maybe it's up to us to partner with certain tertiary institutions, but there's always the possibility of the tertiary institution not being interested at the level you are. Maybe if, as a researcher, you've gotten to a certain level, maybe you have at least one publication, maybe some tertiary institutions might become more interested in partnering with you and you know, applying for whatever grants might be available. So they're theoretically available, but they're not so easily accessible to the basic drug researcher.
I see that you have quite a number of different types of drugs here. Atrazine, immunozine,
fortrazine, jazine. Yes.
How about you? Can you, if given this kind of opportunity, maybe proper funding and collaboration with tertiary medical institutions and support from NAFDAC, do you think you can handle COVID?
Most certainly. Most certainly. You know, as a professional, you don't make claims without data. So what we need now is data. But I've had personal experiences where people diagnosed with, COVID-19 have used this immunozine, being an immune booster and vitality promoter.
For sickle cells.
Exactly. But they use this particular product to actually cure the symptoms. That is, they still tested positive for COVID-19, but they had no symptoms.
Okay, so the symptoms have gone
They had
after
no,
the use of-
exactly.
So which means this drug can be improved upon to get the
Exactly.
total of,
This drug has potential. But what's the interest? I've written to the Kaduna State government to partner with them to run studies on it. But unfortunately, I don't know if it's due to administrative bottlenecks, maybe experience of some fellow colleagues within the ministries. It's like there seemed to be a sort of dearth in the knowledge of running a clinical trial in Nigeria. Or maybe we think this is something that can only be should I say, imported knowledge, study run outside, maybe America or UK or Europe, and fed to our professionals here. It's like we seem to have a dearth in believing in our ability to be able to execute such research projects here, and it's really been I would say a bit daunting, a bit heartbreaking, that even when you do it, there seems to be a sort of, they sort of start treating you first at arm's length. Cast some doubts on what you have done until maybe they say, okay, this is your data, these are the people involved in the study, and then still at the end you see, well, okay, I strongly believe that more could be done. I'll not say the government is doing nothing at all, but I really strongly believe, and not only government actually, we always say governments. I think within our, not only corporate bodies, within our researchers, my professional colleagues, if we have really shown acumen to really generate knowledge, not import knowledge. We have our, our tertiary institutions, our colleagues within the government really blaze a trail on research ability, show what it entails to carry out a study. I believe would have gone far much further than this, because maybe really there's a sort of, people become comfortable in government or whatever job they are, and they don't really see the potential that they can become more comfortable if they really pursue this, or that they can actually create a space for themselves and the future generation of researchers that a new industry could actually be carved out within the health industry, within the pharmaceutical industry. But it's quite sad that there's not been so much interest or ability to do that.
Okay.
Yeah.
Now you mentioned, perhaps there's a dearth of either cooperation amongst you researchers yourselves, or even the medical industry, both in governance and outside governance. You talk about corporate bodies, pharmaceutical companies that are strong to support this kind of. But is it that there is no unity of purpose amongst you professionals? Because if you will come up with immunozil that will help sickle cell anemia, which is already approved by NAFDAC, it's already in the market, it's working. It has even worked in taking care of some symptoms of COVID-19. Is it that there is some kind of competition to, okay, I'm the one who got this, and so you don't get support from your colleagues, or what is really the problem? What are the challenges that you face as researchers? That's the thing.
Yeah, I don't really think there's a competition as such. I don't think someone is out to make sure we don't succeed. I don't think that's it really. I think people don't really know the potential of what we have. I think it's Professor Morris who that once said that with the potential income from herbal medicine, we don't need oil.
Yes.
I'm going to repeat that it's true. If people knew the potential of herbal medicine, oil would just be something we have, but not something that our budget benchmark is decided on. And back to your question about competition, I don't think it's competition. I think also people also think research is something we don't have the capacity for. I think people are not confident to go into research. People want to be fed knowledge from America or Europe. I mean, people want to hear in a study carried out by Harvard University, you know. But I think we should hear more of in a study carried out by ABU or Uniben. You know, I mean, they will not come and do research on our products. No matter how poor their products are, they'll rather do research and bring out the good sides of their products and sell to us. Much more than using our product that's better than theirs and doing the research to generate the data required to prove the efficacy of that product.
Well, for us in the media industry, we thought the advent of COVID-19 pandemic was going to open up the pharmaceutical industry in terms of research and production of herbal drugs like this. We thought it is going to open, but apparently it's not. It's not happening. What do you think so?
Unfortunately, although I would not say it's the end of the pandemic, we're still in the pandemic.
We are learning to live with it anyway.
Exactly. But I think if we don't take the opportunity, it's going to be a missed opportunity. Because how many months down the road, living with COVID-19, we're still yet to have a single product approved for even management of COVID-19. But let's face it, we know that there are lots of products out there, whether herbal or not. I mean, what is administered to people in isolation? Immune boosters, vitamin C, good diet, some sunlight, you know. So what can we not do to bring out a product that if people on that product, especially people on high risk to basically succumb to symptoms of coronavirus, like the older people, why can we not bring out something as a nation or a continent to say, instead of locking down everywhere, I don't want to go into the political intonations of this, it's not my area, but instead of locking down everywhere, give these proven products to the at-risk population.
All right, thank you very much for coming on to the program today, and I'm sure we will come back to you again one of these days, because as long as we have people like you who are willing to really dig in and do some homegrown research to get our herbal treatment, which we expect is going to be the final cure for COVID-19 eventually, we will come back to you again, I'm very sure. Thank you for being there for us.
Thank you for your time.
Yeah. Well, that's been our discussion with pharmacist Umar Ndagi. He is a researcher, pharmaceutical researcher, and an industrialist, and a thoroughbred professional who has passed through all the processes. He has come up with quite a number of drugs, immunozine, atrazine for arthritis, V-Stream, several types of immune boosters with NAFDAC registration. But the problem is that our local pharmaceutical researchers are not being patronized by government. Now that COVID-19 is here, there is no vaccine, there is no cure, and it is very, very clear that this thing may come down to using herbal drugs or herbal processes to come up with cures, because we have seen attempted cures from the one from Madagascar. We hope to see the one from Nigeria being exported and being tried outside again with the help of people like Umar Ndagi, who also requires only government recognition, not necessarily funding. That's been the program for the day. I am Umar Katsumbo. Good morning.